Yes, Gita?
Are we on?
Yes.
Yeah, we'll just give a few minutes for the attendees to come into the meeting. Just wait about 2 minutes and then.
Okay.
And greetings, Marco. Greetings, Waliat.
Hi.
Hi.
Hi, Marco. Thank you for coming.
No, thank you for inviting. That's very exciting. Thanks so much.
No, thank you so much, Marco.
And the meeting is open, but we're waiting a few minutes for attendees to join.
While we're waiting, can you say again who this be a combination of graduates to postgraduate students? Is that, and what kind of attendees are we expecting?
Is that right, Cheryl, that it's going to be graduate students and undergrads from UP, or is it mostly grads?
It's masters and PhDs, yes.
Okay.
And Marco, I'll speak to you. Marco, we didn't, I don't know if we've discussed this or even with Julie and Cheryl, but I'll make sense for me to go first, correct?
Yes.
Okay, thanks.
Yeah. Lai, can we start?
Yes, Getal, you can start.
Okay, thank you. Thank you, everybody. Good afternoon and good morning, depending on where you are. And today we'll have a very, nice presentation and very timely topic on the measurement of resilience. So we'll have two presentations by Mark from Cornell University and also from Marco from the FAO. So before I briefly introduce the presenters and then invite them for first presentation. I invite Professor Shail to give us some remarks about the seminar and also some introductory remarks on this series. Yeah. Over to you, Professor.
Thank you so much, Gitao, and thank you to you and the Academia 2063 for this amazing opportunity for our students to engage with really critical topics and the work that you have put into the ATOR in particular. So thank you very much, Mark and Marco, for joining us this afternoon. We're really privileged to hear firsthand from you on the work that you have contributed to the ATOR. Resilience has been around as a topic for probably the last 15 years, but I don't think the urgency has become as clear as it has over the last couple of months with the new IPCC report released, with the war in the Ukraine showing us just that it's not only COVID that makes our systems less resilient, but that we need to think of resilience in very innovative ways going forward. So thank you very much. We really do look forward to your input and of course to the discussions and the comments that will come from Mwanza and Waylet. Thank you so much. Thanks, Gitao, back to you.
Thank you, Professor. And yes, today we'll have two presentations, as I said before, both almost related topics on the measurement of resilience, which is really as a topical, a timely topic, because we are experiencing a lot of shocks, global shocks, and starting from human-induced shocks and also climate shocks, a lot of shocks, including COVID-19 and all those stuff. So I think we'll have a little bit discussion of the measurement issues on those resilience issues. So the first presentation will be by Dr. Mark Constance from the Cornell University, and he will be talking a little bit about measuring progress towards the Malabo Declaration goals in the midst of COVID-19, a measurement approach for health systems, system sensitivity resilience score. So Dr. Mark is an associate professor of international and development economics at the Charles Deason School of Applied Economics and Management at Cornell University. He's a fellow of the Tata Cornell Institute for Agriculture and Nutrition and a fellow of the Cornell's Center for Sustainability. His research is focused on the development of assessment tools and evaluation designs to measure the ways in which households and communities situated in stressed and shock-prone context and achieve and maintain well-being. He regularly participates in expert panels on food security and measurement issues and has served as an advisor to the several organizations within the United Nations systems. As part of his applied work on resilience measurement, Professor Constance part of the leadership of the resilience evidence for decisions in development institutions. So he has published a lot of articles in well-known journals, and also has contributed a lot on the for both for academics and also for policy audiences. So we are glad to have him today for his presentation. I think he will share us his experience on measurement issues for resilience. And then I think after Professor Mark, then we'll have a discussant from the University of Pretoria, Wyatt, and I will introduce her later on after the presentation. Now the floor is for you, Mark.
Okay. I'll do my share screen here. I think we've tested it and it's worked. Very good.
Yes.
You have my screen. Great.
Yes,
well,
we can see that. Yeah.
Excellent. Well, thank you. Let me begin by saying thank you for inviting us. Measurement, which is the focus of much of what I work on, and Marco as well, is always a work in progress, and particularly in the context of resilience, because resilience has a lot to do with shocks and stressors, and the shock and stressor environment is one that's constantly changing, and particularly in developing countries where vulnerability levels are higher. Historically, and I would even say somewhat conventionally, a lot of the work on shocks and stressors had to do with droughts, floods, conflict, and maybe food prices and other things. And as we all know, in the last couple of years, we all now have to pay close attention to the idea of a global health shock. We had Ebola primarily in Western Africa, which is a regional shock, but the idea of a global health shock is something new to us. And it compelled the work and a focus point for the ATOR volume that was published last year, and is a measurement topic is a concern for what I'll be presenting here in brief form. So that's background. Let me proceed now and give you a sense of what my objectives are. The first is to highlight the importance of health systems data for development research and for resilience in particular. And I'll have a little more background on that, but when we look at how health systems and how health data are incorporated into development work around food security, it's typically around food safety issues, and thinking about aflatoxins and things of this sort, and food handling and maybe sanitation around wash, but not so much around the health system. So that's one motivation. Another motivation and objective is to explore how health systems data may be incorporated into Malabo reporting. We make a first effort at that in the context of the African Agricultural Transformation Scorecard. Thirdly, present results of proposed measurement framework focused on health system capacity and the economic and country resilience capacity, which we've constructed as a first effort. I will say by way of a qualifying statement, we regard these at this stage as scores rather than indices, which brings me to my fourth point, provide an initial setup for more extended empirical applications. So I put the burden here on Marco, where they do actually develop an index using health data as well, on a 2021 paper that was done for the volume. And also I believe he has a 2022 update. Moving on, the way my talk will proceed is first I'll frame the study by describing the context, motivation, and purpose, describe the basic empirical approach, that is our conceptual model and the data we drew upon, provide the results by region and by country, and then provide some implications and next steps. The asterisk that's mentioned there was a reference to the fact this is on another page, and on the front of my presentation is the asterisk is a reference to the fact this is built on a presentation is built on a chapter that was done with co-authors Max Wolgemuth, a graduate student here, and John Ulimwengu, my co-editor on the volume itself and colleague at IFPRI. So again, reiterating the point I made to begin with is that we've had these shocks that we're used to on the right-hand side in between the green arrows, and now we have those, plus we have COVID. So as to the context, motivation, and purpose of the work, the Malabo Declaration goals have a clear focus on resilience, and the CADA framework, the results framework, results 1.4 and 1.1 to 1.3.6 focus on resilience, but there's a limited use of health-focused indicators, as I mentioned, and primarily around food safety, as I mentioned earlier. Secondly, there's existing empirical work in this area looking at the impacts on trade and the question of trade dependency as a broad indicator of vulnerability. When there's a global shock, and in this case, a global health shock, trade becomes important. And then, as we all know, if you even on a mundane level going to a local store, supply chains have been impacted both locally and regionally, and certainly beyond that globally. So trade becomes important. You'll see in a moment how we leverage some of that work that's out there. So the specific purpose is to explore the composition of indicators that reflect country level or macro sensitivity to the factors that may be associated with resilience to COVID-19 impacts. And I'll develop those for you in a moment. So the theoretical perspective we approach is the ability, looking at resilience, the ability to anticipate, absorb, adapt, or transform in the face of shocks. I would argue for COVID-19, there was very little anticipatory, and most of it is dealing with trying to absorb and adapt to a certain extent to transform. Very little in the way of anticipating. Nobody anticipated COVID-19. Well, I shouldn't say nobody. Actually, some people did predict this, looking at Ebola. And I think it was it Marco's quoted this, I think it was Steve Jobs who said that in the future, our main concerns will be I've forgotten Marco. I'll ask Marco to have the quote, but it's a concern about the spread of viruses rather than other things. So I'll put that quote on Marco. He remembered it. So, okay, again, our theoretical perspective in the middle is supplemented further by, or the contextualized with the Malabo Declaration and the CADA framework, which I think many of you are familiar with. I won't go into detail here. The basic empirical approach is our conceptual model and data sources. This is a stage 1 and stage 2. In stage 1, we develop the elements to develop the score, which are comprised of a health systems capacity score. And here we're looking at vaccine rates, hospital bed density, and medical profession density. And in all cases, for the 2 cases for hospital bed density and medical professionals density, those are per capita indices that drawn from the World Health Organization, and the vaccine rate from our world data. The second element of our model to build a resilience capacities score for global health shocks is the economic and country resilience capacity. Here, as referenced a moment ago, we look at elements such as trade dependency, supply chain efficiency, and then we add another element looking at overall country fragility, drawing on in that case, on the Fragile States Index, and the first 2 elements for trade dependency and supply chain efficiency from the World Bank. So we use those to construct the resilience capacities score for global health shocks, which is a function of those 2 elements. And in stage 2, we then combine the resilience capacity score for global health with global health shocks with the Malabo indicator, and then examine how it's distributed with the index that we derive from that. So what we're trying to do is say, look, we can develop a score which is representative of what happens in the face of a global health shock, part one, and then take that and partner it or combine it with the African Agricultural Transformation Scorecard Index, which is, by the way, has to do with climate, as you'll see in a moment, with amount of investment in climate-related resilience. And the score, the countries we're working on are 36 countries. We were not all the countries in Africa, primarily constrained by the countries on which we could get complete data sets. So Central, Eastern, Southern, Western Africa. And you'll see in a moment that we also report our findings accordingly and then dig down to a certain degree into country level findings. So the findings, let me first give a preliminary note. I want to focus on health systems because this was one of the strong motivations for the work. When I started to dig into the health systems data, I realized there was, not surprisingly, a great disparity. So I want to highlight those and then go into the main findings. And some of you may be keenly aware of these already, either in the news or in your own personal research experience, or just living the continent, you'll understand these. So let me first focus on the health systems data and first focus on vaccine rates, looking at partial vaccine rates and full. And the point of comparison, I'd like to compare our findings in Africa on the continent with G7 countries with an overall average of 58%, and on the highest being Canada, followed by the UK and US, and trailing behind Japan. There are interesting questions about why there's this variation and why Japan was lower. But that's a project in and of itself. What I want to do is just to compare these figures to sub-Saharan, which had an average of 2.55%. So I mean, this is quite a shocking comparison here. And the lowest rate of vaccine administration in a G7 country, the lowest, is nearly 10 times greater than the vaccine rate in the highest region of Africa. So these are pretty, I think, sobering findings here, and they're indicative of health systems capacity in general. And we then can look further into hospital beds and medical professionals, hospital bed density, or the number of hospital beds per capita. Medical professionals is a combination of doctors, midwives, and other health workers. And here too, we have a rather stark comparison as well in looking at the different, the availability of health services. Again, these are only two indicators. When you get down to more specific indicators, in some cases, it gets more stark. I was working with a colleague in South Sudan. We were talking about the availability of ventilators, and he said, and I don't know, this is never verified, he said, in South Sudan, he believes they have maybe 5 ventilators in the whole country, and they weren't sure if they all worked. So when you get down to the equipment level in actual facilities, it becomes worse. So this is a strong motivation which made us raise questions about the disparities in health systems between G7 countries and across, and also variations within the continent. So, okay. So let me now go into the results. And how much, can someone tell me? I'm not watching time very carefully. How much time have I used so far? How much time do I have left? So, Guitar? I think I have.
Sorry, I was muted. 5 minutes, yeah.
5 minutes.
You have been allocated for 50 minutes, and we are already used 10 minutes.
Okay, well, what I'll do is I will unceremoniously and impolitely, I'll have to skip over some slides, but these slides will be available for you. So I want to talk about the stage 1 results and the stage 2 results. Stage 1, looking at regional differences, country level results, and look at effort to isolate most resilient to least resilient using the health systems, using the resilience capacity score against a global health shock. And then I may not get to stage 2, where I look at the Malabo, how it combines what it looks like when we combine it with a Malabo-based indicator. So looking at the regional focus on the health systems capacity, economic and country resilience, we have regional variation, again, using the health systems capacity score and economic score combined. And again, this is looking at the trade element and logistics performance index from the World Bank. And you see there's variation by region, central, eastern, and southern, with central displaying the highest level of resilience and also the lowest level sorry, the other way around, I flipped it. With central displaying the least resilient and the lowest levels of most resilient, in Southern Africa, including South Africa, as you'll see in a moment, displays the highest level of resilience based on these metrics. And looking at a country focus using a quartile rendering from and then above the mean and below the mean on that as well, you'll find that that in Southern Africa, where you are, Botswana, Namibia, and South Africa and Zambia are above the mean, where Eswatini, Lesotho, and Zimbabwe are below the mean on the health systems capacity score. So just moving quickly here, then looking at the least resilient, Liberia, Guinea, Mali, Niger, Sierra Leone, and in Southern Africa, the least of the least resilient are Angola and Mozambique. So let me go through and just kind of show you what the combined results are of these on the global health score. Now I want you to take note because we're speaking to, you're in Pretoria, to South Africa. South Africa ranks the highest when focused just on the global health score. And you'll see that this flips in a moment when we include another indicator from the African Agricultural Transformations Scorecard. We introduced a tentative threshold there at the mean, but it's interesting here to look at those countries that are in the top quartile. And the interesting part here is how it moves, again, when we add the climate indicator. And this is really important because, as you know, shocks don't stay in their boxes. Sometimes we have one shock and it just operates on its own. Shocks interact with one another. And that's going to be important when we think about other sources of investment in resilience. Again, the most resilient is South Africa. There's a list there, and the least resilient on this ranking are Somalia, Chad, Guinea, Liberia, and so forth. And then we combine it with the African Agricultural Transformation Scorecard, and we use a climate indicator because, again, COVID doesn't live on its own. It exerts its effect negatively while other things are still going on. And the AATS component of the resilience includes the climate element. And here, interestingly, you'll note South Africa moves from top place down into a lower quartile here. So the movement is really interesting, and I think a cause for concern because we look at the climate drivers, which have a really important effect on food security outcomes. And we look at the COVID ones together, the picture changes. And the countries that are most resilient, there's some place changing here, and those that are least resilient. Some are persistent, the ones in dark, and there's a little bit of movement. At least there's less movement in the least resilient, and there's much more movement in the most resilient. So that kind of sensitivity is interesting when you combine the climate with the COVID. In my final slide, I'll just present here. Look at the rank order changes. This looks at the change between, excuse me, sorry for the cough, is the rank order change is a change when you add in the climate plus the COVID. These are the rank order changes. The ones that are relatively stable are Somalia, Niger, Congo, and Cameroon. And the ones that improve are showing on the top here with the benefit of climate in the face of COVID. And the ones that suffer the most when you combine COVID plus climate are down here in the lower part. So in the interest of time, I'm going to go on. Sorry for the rapid one, but Marco will clarify all the points that I've made that need clarification. Marco and I are friends, by the way, not just colleagues. So again, the most gained are Mali, Ethiopia. The most lost with the combination of climate and COVID works out this way. The implications of the study, I have 4 concluding points, is one, this is a first approximation. There's a need to refine the measurement model and extend the set of health metrics beyond just the ones we've included here. This is a first iteration. We need to build precision into trade by decomposing the trade variable. I have EG there. I've forgotten why I didn't finish it. Sorry about that. Also, it's really important to think about the indexes that we've developed here, the scores, as having the potential for an early warning, contribute to an early warning system. That as we know which countries have the lowest capacity on health and on sensitivity to an outbreak such as COVID. Sadly, this may not be our last global pandemic, and looking at incorporating health into an early warning system could be important. Replicating the effectiveness of resilience capacities is going to be important. And then I want to skip quickly to future work. It's going to be important to examine how the impacts of global health shocks may be incorporated into reporting on agricultural productivity as part of reporting the Malabo Declaration goals. As I mentioned, a big part of the motivation here was that the health component of the AATS, the African Agricultural Transformation Score, was just around food safety, had no information on health systems. It's not too heavy of a lift using the WHO data and our World in data to add some health indicators as well. So future work is to examine how the impacts of global health shocks may be incorporated into reporting on agricultural productivity as part of reporting the Malabo Declaration goals, and also to explore the value of connecting health system metrics to existing forms of resilience measurement. That future work is in a few minutes when Marco will speak, using REMA as a platform, and you'll hear more about that in a moment. So I'll stop there, and sorry for the rushed one. My timing wasn't as I hoped, so thank you.
Thank you, Mark, for your nice presentation and very precise and brief on the capacity, resilience, measuring resilience capacity on health and economic and country-wide, and also comparison with the Malabo measurement of resilience. So I think thank you for this one. As usual, we have discussant from the University of Pretoria. And today we have, for this presentation, we have Waliat. She will be the discussant for this one. Waliat is a PhD student in the Department of Agricultural Economics, Extension Rural Development of the University of Pretoria. She is studying the value chain frameworks to enable commercialization and the case studies of selected underutilized African crops in South Africa. Her career goals are to carry out relevant research and be one of the primary policy drivers for sustainable food systems. So with this background, she's a PhD student and she would like to give us a brief comments on the Mark's chapter and Mark's presentation. Waliat, over to you.
All right, thank you so much, everyone. Thank you, especially Mark, for your presentation. After I got the information that I was going to be a discussant, I actually went to look at your profile. I saw an interview on IFPRI in 2014, and I saw that the resilience study that you have embarked on has been for a while. So I want to commend all your efforts towards studying a resilience call for vulnerable communities in Africa, who reside in Africa. I also had a look at the chapter. I know I don't have so much time, but I have quite a list of things I wanted to talk about. Since we're trying to measure resilience score in the face of COVID-19, I believe that COVID-19 is one pandemic that it's not going to go away immediately. So there's something, I don't know if it's a question or if it's a contribution or if it's just a comment. I believe that since the effect of COVID is continuing, can we really put a timeline to the period that we can feel the severity of COVID-19? And what impact can this have on your study and also on the choice of indicators? You're trying to put together some sets of indicators to measure resilience score on how much the vulnerable communities can most build resilience to the effect of COVID-19. I believe that the effect of COVID-19 is continuing. So what will this have? What kind of impact can this have on your study? That's the first comment. And also, I wanted to ask, is there like a uniform tool of measurement for which part of the value chains is most affected.
Yeah.
All right. Also, in evaluating the impact of COVID, what will be the ideal duration to use for such evaluations for this particular study? I have a lot of questions. I don't know if I'm able to go through everything. And also, will it be an equally acceptable measure to use the rate of increase of vaxxed persons to measure how quickly a developing country would be able to bounce back after the level 5 strictest level of restrictions? The reason I am putting this forward to you is that in some countries were slower in getting a large population to be vaccinated, while some others seemed more developed than others, and they were able to get some of their population vaxxed. So I believe in Nigeria, the statistics, one of the problems that we have right now in a lot of the vulnerable communities or vulnerable countries is the lack of data, which you have specifically noted. But I believe that in a country like Nigeria, it seems as though a lot of people are not getting vaccinated, but they are actually getting vaccinated, but there isn't any sustainable data to show that. And I believe that one of the reasons why a lot of people are getting vaccinated from a country like Nigeria is because many people actually do travel out of the country. And one of the criteria for you to be able to travel in many of these other advanced countries is whether you're vaccinated or not. So that's why I'm asking for, I'm talking about this as compared to some other developed countries. I also believe that you made a classification in regions of how these places have been vaccinated, or how these countries have been vaccinated, central and all of those. But I believe that maybe an institutional, or how will I put it? I don't know how to explain this. Maybe looking at the specificity of those factors that really contribute to whether people are being vaxxed or not, I think is going to be very important as well. I don't know if anybody's taking a tab on my time, but I still have some more. Can I go on, or is that fine?
I think we can come back later on with the Q&A question. Session. Yeah. Let's Mark say something, and then we move on to the next presentation. Yeah.
Yes. Yeah. Thank you. These are wonderful. Very nice to meet you, first of all, and I appreciate you're taking a close look at the work, and these are really thoughtful questions that you pose here, and important. I have 4 of them here, and I may have missed one, so let me go through them. Because some of the questions you've raised are important for COVID research, and others are also important for research in general. And the first one you mentioned was thinking about the time dimension of the impact of COVID, and indeed for the impact of any shock or stressor, right? These shocks and stresses aren't like a light switch. We don't turn them on and turn them off, do we? They have a sustained effect, and they have a spatial effect too. And thinking about the differential spatial effect, the different time effect, and the lags is really important. And since you're a student in economics, you understand that how we think about lagged variables and how we construct those kinds of variables is really, really critical to our precision. So at this point, I wanted to say that first of all, I agree with you, is that this is not an effect that's going to go away. Even if today we could say COVID is done, the effect of the shock is going to be a long time, right? And so this speaks to the fact that when we need to continue measuring the effects and understanding that there's heterogeneity, that some areas will recover more quickly than others. Even here in the United States, in New York City, where I'm not too far away, very different situation, but they say, a very large number of businesses in Manhattan will suffer and will never recover, will never return. These are not people who are close to suffering the way people suffer in sub-Saharan Africa, but the sustained effect, there will be no going back. Things that will be forever changed. Market structure has changed. So thinking about the time and timing of data, one of the points I'd like to make is thinking about the frequency of data collection, so we can have a better sense of the volatility of how things are going up and down over time will be critical. Your second point, which we only had a very crude proxy measure for, we didn't get to the level of value chains, and we use the logistics performance index to get to supply chains, is that most people agree And FAO has written about this, has reports on the importance of looking at supply chain disruptions, global supply chains, and regional supply chains. And I can tell you that it's a really important, and Marco may have his insights on this as well, but an area of work where we need more research is on supply chain resilience, and looking at value chain resilience and how those changed and how they can be altered to preserve the integrity of a value chain when faced with a shock. So I think you've identified an area of research that needs to be done, and is simply a gap. Your point on vaccination rate is really interesting, and I think you mentioned institutional level response, but as you know, there's also, certainly here in the United States, there's a strong sociological element as well to vaccine uptake. So it's institutional and the limits of institutional. And then within that, you pivoted quite nicely and talked about data limitations, which are really, really a serious matter. And here's one of your points, this is true of COVID, but it's true of all of our work. And one of the problems we have when we think about the continent of Africa is the more fragile the country is, the more difficult it is to get good data, right? And that's a kind of very rude irony of data collection, that the more people are suffering, the more fragile a country is. If you think about Yemen or Somalia or South Sudan or Sudan, it's very difficult to get good data, particularly from some parts of the country. So, we don't even know what the vaccine rate is at all in some areas. And so this is going to be a huge problem here. You also talked about, I didn't get your point. I think I didn't completely record your point about regional classification. Could you just say more about that regional classification question?
I was having a look at the way you, in one of your slides, there was this classification according to regions.
Yeah.
There was West Africa, there was, can I see the slide? So I'm thinking that I know that there's a limitation to what you're able to do, but that regional classification, I believe that there should be some sort of more in-depth classification, especially in the most vulnerable countries. That's where I now begin to talk about the institutional factors.
That's a really good point, because I can tell you this classification, this is like a normative typical classification. And you've identified something really interesting here, is that this is not a functional classification. This is strictly geographic. And the functional one is probably more important. If you think about, I may stay in touch with you about this, because if we think about who are the trade partners, where are the trade routes when it comes to port access and to food security, that's what's more important. And this is, it overlaps to a certain degree with this normative geographic depiction. But I think you're right to say that we should think about this in a more precise way. This is normative, this is typical, but it doesn't necessarily talk about trading partners. It doesn't talk about supply routes, how food gets from one part of a country to another, where the import traffic may be coming from as well. So I'll stop there.
Thank you.
Thank you very much. Really good question.
Thank you so much, Mark. Thank you.
Thank you.
Can I ask one question, Walia? How far along are you in your studies now?
This is my third year, although I just presented my proposal, and I'm still doing a few corrections, but that's about it.
Very good. Okay, good. Thank you. Thank you.
Thank you so much,
Okay.
Mark.
Thank you, Mark, and thank you, Wallet. I think you have showed us how complex is measuring resilience, and it's not a simple factor or a single indicator. So with that, I think we'll come back on the Q&A sessions for all the attendees, where they can ask for questions. But now we move to the next presentation by Marco. And Marco Derico, he's an economist from FAO. He will be talking about the measurement of resilience capacities through the integration of macro level and micro level indicators. I think Marco is one of the experts, the global expert we have on resilience measurement. And he has a PhD, he holds a PhD in economics. He's an economist at the Food and Agriculture Organization of the United Nations. He joined FAO in 2009. And since then, he has collaborated with the World Bank, IFAD, UNCF, He is currently a team leader for the REMA, if some of you know that, which is Resilience Index Measurement and Analysis team, and the coordinator of the Impact Evaluation Task Force in the Agriculture and Development Division of FAO. So I think we are very glad to have Marco today, and I leave the floor for Marco. Marco, can you share your presentation? And you have 15 minutes to present your chapter, and then we will have also a discussion from the University of Pretoria.
Sure. Thanks so much for the introduction, and thanks especially for inviting. That's super exciting, and I was just enjoying not only Mark's presentation as always, but also the discussion with Ms. Oloyede. It's super interesting. Thank you so much. I was also considering, presenting after Mark is not simple because Mark is the guru of resilience in the world, and basically I think that 99% of what I do in resilience comes from a discussion from Mark on intuition of Mark. So I don't know. It's like we are downgrading the level of this conversation. I take this as an assumption. Okay, so I'm not sorry for this. In fact, as you can see, even here from the presentation, as long as I can share, I can manage to share. Okay, I guess you guys see the presentation, right?
Yes, we can see that.
The part that I'm presenting has been co-authored with, of course, Miss Elestina Jumbe, is a lady from Malawi working with us here in FAO, but the intuition stems from Mark Constance. So Mark is everywhere here. And then we are also adding, we have added a little expansion to what we presented as the ATOR publication, and this expansion has been mainly led by Ojo, another colleague of us, who is working with the FAO in the regional office in Favraf, but he is based in Canada. Both of them are here today, and so I'm very happy to see that they are participating, and I welcome you guys, whatever I'll be doing not properly to correct me and intervene. So basically the introduction. Again, I'm serious. I'm not kidding. Mark had this intuition on try to combine the micro and the macro aspects of resilience. You may well know that Mark was the director of the at the time called Resilience Measurement Technical Working Group, and one of the things that this technical working group, maybe the major outcome of this technical working group, was a very usual definition of resilience, which I frankly prefer to the definition of. Are you recording this? So okay, which I like exactly like I like the definition of FAO, and then also the intuition of the production of 7 reports, which were working papers, which are setting the scene, one on resilience measurement, and one of these was to see the different scales at which you can measure resilience. Is at household level, community level, country level, and so forth. But those different scales never communicate. And Mark's intuition after what happened with COVID was exactly this, to see and try and see what could be the interlinkages between the different scales, measurable scales of measuring resilience. And so again, as Mark already presented in his presentation, COVID-19, but even other frankly unpredictable shocks that are devastating even Europe, are bringing to the highest possible attention the stress that an event in a globalized world, interconnected world, may have on many different systems. It's not the case that one of the flagship publications of FAO, the State of Food and Agriculture 2021, is mainly focused on agri-food system resilience. Mark, even in this case, has led a background paper on measuring the agri-food system resilience, because exactly for the same reasons. COVID, as well as other shocks, can translate into disruption of already exacerbated and vulnerable situations. A little literature. Yeah, basically what we want to try to understand is the role and the importance of health system. So our work is very well interconnected with the paper, the chapter presented by Mark together with John for the ATOR, the proposed measurement approach for the health systems sensitive resilience index, which I think we should, as a possible pathway for further analysis, try to include, try to combine those two chapters and see what they can do together. And there is another little set of interesting papers that can be helpful to frame the scene, to set the scene, including one where we worked together with Professor Timan Brook, analyzing data in West Bengal Gaza Strip and showing how conflict affected the resilience through the disruption of health system and infrastructures. We employ in our study the resilience index measurement and analysis, and the overall idea is to see how a measure of the health system infrastructure and other macro measure of a country, of a region, can be correlated with the resilience capacity index. And so on this, that's why I think that the work done by Mark can be very much integrated. On this, what we have used is this health system capacity index, which combines together different aspects of the health system. In particular, we look at nurses and midwives, and then we look at hospital bed density, physician density, and vaccination rate. But again, if I think back at the slides presented by Mark, I again consider that we should try to integrate those two approaches. Better say, to use Mark's index of resilience, of health system resilience, into this analytical framework that I am about to present here. So the identification strategy we adopted is to use as a Y some measure of food security. In our case, we have adopted the IPC measure of food security. IPC stands for Integrated Phase Classification of Food Insecurity. Well, first because it's FAO, and so we are corporate people, but also because it's very, very widely recognized, internationally appreciated, and so we don't have many problems or many questions on these aspects. And then we have an array of regressors that we include, where we include the set of the four pillars of RIMA: access to basic services, adaptive capacity, assets, and social safety nets. Then we include this parameter of health system. Then we add the data on conflict coming from ACLED, and then we added also an economic vulnerability index, which is one of those combined indices that exist out in the web. Again, as you notice, we have adopted a very similar approach of you presenting the data, especially as Mark did, because Mark led and drove us on how to prepare these results. And so here you can see two parts of this maybe too populated slide, where we have on the left-hand side of the presentation of the slide, you have this box where we reported how the health indicator, the health infrastructure indicator, and the resilience capacity index. And so you can see that there are countries for which the resilience capacity index maybe is very, very high. Tunisia, the health system is very, very high, but the resilience capacity is pretty much on average. Likewise, we have also countries where we have still average resilience capacity index, but a super low level of health facilities. And so we have different sets, but maybe what is interesting also to see here is Nigeria, that is a country that has a quite enhanced and advanced resilience capacity, but a pretty much average level of health infrastructural index. And so on this, on the right side, we have basically prepared the same type of say classification, where you can see the different clusters that we have presented. Now, getting to the empirical results of our initial analysis, the part that has been presented as an ATOR, chapter. These are the results. I'm sorry, because I have a cold. I have a bad cough, which is not not at all connected with COVID, but it's complicated to speak in this case. And so in this case, we can notice some very interesting results. And in particular, we think that the most striking and most interesting result is how the role of the health infrastructure, say, level or index can affect food security in different countries. And also, of course, how conflict, can have a similar effect. You may notice some switching in the signs and in the magnitude and the signs of the regressors, which means most likely that we still need to better specify the model, because in any case, we have this economic vulnerability index, which can be maybe carrying a little bit of noise, a little bit of buzz into the regression analysis. But in general, the indication is quite clear. So then we tried to further expand this analysis, and this is what we call the extension. And again, I would like to thank particularly Oggi and Elle for the work that they are doing on this. So in the question that we asked ourselves during a conversation after the presentation of the ATOR chapter is whether health system capacity can influence the resilience capacity in specifically conflict-afflicted countries. So for doing so, we have done, the spin-off question that we asked ourselves is whether there are any country-specific factors that can contribute to resilience. And so for doing this, we have added another couple of analytical approaches. The first one is the following here. So here what we have done is to use the resilience capacity index as a Y. So you can notice here on top of the table of the results that now the Y is the resilience capacity index, is no longer the food security level. We are just willing to understand whether there is a specific effect on resilience. Just bear in mind that in this case, we have reduced the list of countries to those who are conflict affected. So Mali, Mauritania, Nigeria, Sudan, Sierra Leone, and Zimbabwe. And then we have also adopted, this is a fixed effect model, and then we also have included, at least in this model here, the years. And so using as a dummy for checking whether they know the duration of conflicts and the duration of the data that we have can have an influence on resilience capacity. Now, what we find here, which we think is interesting and then is needs also further expansion, is that conflict, of course, this is just a dummy, so this just says without measuring the intensity of conflict, but this just measures whether the country has experienced the shock or conflict or not. This is telling us that conflict reduces the resilience capacity index very much when we control for the countries. A little when we control for the year, so we control for the time heterogeneity, we don't control for the spatial heterogeneity, while when we combine the two, we drop this variable, and so we lose it. Otherwise, it is interesting also to notice that this so-called health infrastructure index, or whatever is the name, has an increase. So the more developed is the health system in a country, the higher is the resilience capacity index. Interestingly, we can notice that this is remaining valid also when we control for both spatial heterogeneity and time heterogeneity. The last research question that we asked ourselves, and we try to respond by using those two specific cases, so Nigeria and South Sudan, so the Republic of Sudan, is whether specific classification of countries can have a specific, can be associated with specific characteristics of the resilience. Now, in particular, Nigeria is marked as a food crisis country, while Sudan is marked as both protracted crisis countries and food crisis countries. And so what you can see here, you basically, this analysis on the left part of those two tables is just the panel analysis, while otherwise here we have left the two periods because we have two observations over time, what we call this line of follow-up. And we just wanted to separate to see whether there is a difference between baseline and follow-up. But what is important for us to mention here is that in a country which is a food crisis country, adaptive capacity and safety nets are along those that are the most relevant component of resilience. You see here, basic services and assets, they're a little behind. And this is food crisis countries. Otherwise, when you include the definition of productive crisis countries, which helps to remind, meaning that there is a continuing, a prolonged crisis ongoing, the more important variables tend to change a little. We maintain a very important role for adaptive capacity, which to me is maybe the most important aspect. The most important, not in terms of relevance, but the most recurring relevant aspect of resilience overall. In all our analysis, what we have always noted is that the diversification of income sources is the most important variable for explaining resilience. But look here, we have all of a sudden we have a super important role for access to basic services. We still have a very important role for female-headed household. We don't like too much this variable because it's limited in its capacity to represent the real gender dimension, where gender does not mean the necessity to be associated with women, but it's just to measure the differences in terms of gender. But in any case, what we think relevant in terms of the resilience analysis is exactly that social safety nets play a major role for food crisis only countries, while when we talk about protracted crisis countries, access to basic services reaches a much higher relevance. So with this, I conclude, and I just want to thank you for the opportunity that you gave me.
Thank you. I think this is a very nice piece of work, and it has, looked at the health capacity with resilience capacity, and also conflict, how the different crises. So generally, how the different crises can really contribute for the different resilience capacities. So thank you, Marco, again, and we are glad to have you. And we have also a discussion for your presentation from the University of Pretoria. And today's discussant is Ms. Mwanza. And Ms. Mwanza is an MSc student in agricultural economics at the University of Pretoria with a major in food security. She's studying food security. She holds a bachelor degree in agricultural economics from the University of Zambia. And previously, she worked for the Food and Agriculture Organization of the United States in Zambia as a research associate, and World Food Program as a monitoring and evaluation assistant. So she will give us briefly what's her observations and also what she thinks about the presentation, because this is a learning process and we want to get her own views. Mwanza, are you here? Over to you, if you can hear me.
I can hear you. Thank you so much, Gatal. And thank you to Dr. Marco for that wonderful presentation. Like Dr. Marco said, I think that moving from Walitaya and to me is like a downgrade, but I will give an overview of my thoughts on Dr. Marco's presentation. I think overall, my takeaway points are that indeed other shocks that countries face, like conflict, inequality, because he talked about women, female-headed households and how they're vulnerable, and also conflict reduces a country's level of resilience. So I think, Dr. Marco, I would just like to find out from for the countries that you looked at that are faced with conflict from time to time, definitely we are in a situation where we believe that conflict in these countries may continuously occur from time to time. How then can governments in these countries provide policies that will help build resilience of its people? Because with shocks like COVID-19, which are definitely unanticipated, and because of our experience now, we do anticipate that more shocks like this will come across in the future. So countries like this need to be better prepared, or prepare their people, considering they also have other shocks like conflict and climate change that affect their food security. So how best can such governments be prepared for such type of shocks? I think that would be my first question. Then basically, I want to agree with the result finding. I think when I read your chapter, Dr. Marco, I realized that governments that provided social protection, like in Tunisia, where governments provided social protection for the most vulnerable and informal employed people during the COVID pandemic, you found that their risk to food security was lower as compared to Mali, where they have a situation of perpetual conflict, and there was no social security safety net to cushion the effects of the pandemic. So I think that will be about it. Thank you.
Thank you, Moaza. I think I will give the floor for Marco to respond for the questions and also for the comment. But I also want to remind the other participants to think about the different questions. You may write in the Q&A and the chat box, or you can raise your hand and after Marco's remark on the Moaza's comments. So Dr. Marco, the floor is for you to respond on the preparation for this type of unanticipated shock, and also the role of social protection vis-a-vis the conflict, perpetual conflicts. So over to you, Marco.
Well, thank you. Well, first, thank you, Mwanza, for the questions, and think your questions inverted the tendency. No? So from Mark to Marco, and then your question managed to bounce back to a good level. So thanks for the questions, which raised up the level of the quality we are offering to our audience. So I think that, okay, one of the things that Mark was saying during his presentation is when we WhatsApped each other about the sentence of Steve Jobs, that he basically said, Mark, correct me if I'm wrong, but I think this is what you were referring to, we will be killed not by the atomic bomb, but by a virus. So that's what he said. So he was actually predicting that something like a COVID could happen. You know? So I think there is a social responsibility which sometimes, and we are witnessing this, by the very difficult to understand behavior that we are witnessing in Europe, where a war is killing people, is destroying food system, is destroying is putting dramatically at risk the production, the distribution, and the dissemination of wheat, fertilizers, and so a number of threats to the global food system that is very complicated now to imagine the consequences. No? It's easy. 2 days ago, we launched the global network, the global report against food crisis, and the numbers are striking. We are talking about 193 million of people that are on crisis or more, and these numbers are estimated to increase. Okay, and so that's, to me, there is a component which is a sort of a social responsibility, and there must be organisms that can stop things like this to happen. Okay. At the same time, I think it's also an important role from a UN system. And sometimes, yesterday I was lecturing at the university, and I was presenting a case where a UN agency was working in a certain country to provide assistance in terms of health provision of health support, and instead of investing a lot on the local health infrastructures that would have left a legacy, once the project was over, a sustainability, because at that point you could have a better restoration system. And the result, they otherwise invested in NGOs that went there, set up a temporary camp, and then everything was cancelled. So a serious intervention on the sustainability, on a sustainable improvement of the health system is, to me, the best response that we can provide. I was not shocked, but very interested by one of the slides that Mark presented. The slide on the number of what was that, Mark? Was the number of beds in the hospital and the numbers of physicians or doctors or nurses, so professional staff working on that. In the US, the number of beds is like in Italy pretty much, but the number of trained people, very high qualified people, is so much higher. And that really impressed me. So the best way to respond to this type of unforeseen, now seriously speaking, the unforeseen shocks is to strengthen in a sustainable way the health system, so to make sure that, as we have seen, can positively contribute on the on resilience and food security. On the role of social protection, I mean, social protection, I think, is now one of the largest share of the budget of every UN system, of every donor, of every person and institution working in the development, in the international development. And there are ample proofs, a long list of well-written and published papers that are demonstrating that it's super effective. And so, again, it's interesting, I think, in the last slide that I presented, it's super interesting to see how social protection just arrived as main important in the country that is more exposed to food insecurity. And in the case of Nigeria, if we think of what is happening in Borno State and in other states which are risking the famine, but they're risking a very high level of food insecurity. It's super important. So on social protection, I can't agree more.
Thank you, Dr. Ma. May I just ask one more?
Please go ahead.
Okay, great, thank you. I believe while social protection is a good social safety net in cases of shock and disturbances, but I have seen a situation in my country where it's created a mindset of dependency and encourage people to wait on somebody to do something about the problem rather than do something about the problem. So do you feel like in the long term, social protection is a sustainable method of cushioning these problems that we're facing?
Well, thanks, Mwanza. This is a very important question, and actually, I understand you are from Zambia, right? So I did some data collection in Zambia, right? Right. I'm from Zambia. Yeah. So I spent a significant amount of time in Zambia doing data collection, specifically for data collection of an impact evaluation for a cash transfer project, and so social protection intervention. And besides the fact that I enjoyed a lot the countryside, the Shima and the caterpillars and everything else that I have eaten there, and the people, fantastic people, we worked a lot, especially on this, in trying to understand whether there was a sort of dependency. Now, I can tell you not from my experience, but from the papers that I see around, that there is no scientific evidence of this type of dependency that is associated with cash transfer. And also, it largely depends also on the type of social protection intervention that you can think. In a developed country that is maybe not continuously risking the exposure to specific shock, having still the possibility of insurance for the agricultural crops, that's super important, because otherwise all of a sudden something happens and a farmer which is bearing a normal life but it's not super rich, risk to see everything collapsing. So for me, social protection, indifference, nuanced fashion, but is still super relevant and super important and cannot be really, removed. And I don't think there is evidence on the dependency due to cash transfers. And also, cash transfers normally, sorry, I'm an Italian, I talk too much, go.
No, it's okay. Yeah, because I think, thank you again, Marco and Mark. And I think this is a place where the senior scientists meet with the junior scientists, the upcoming African scientists who are working on policy analysis and all these things. So I think we can take time and we can explain things as much as we can. So now I open the floor for everybody to ask questions, both for Mark and Marco. So maybe I can see from the chat box that Professor Shell, you have some questions on social protection. Can you ask or just?
Yeah, sure. Thank you. And thank you for the fantastic presentation. Lots of work behind both of your presentations. Thank you so much. Quite fascinating, and some great direction for the students as to where the gaps might be in future. But I was curious from both of you to understand, so usually social protection programs are seen as a way of supporting resilience in the countries. But last week, the South African government declared that just under, I think it's 47% of South Africans rely on social protection for access to food. And I'm wondering if this kind of reliance, and we talk about universal coverage and also, how the reach of social protection, but if we shouldn't start looking at how much reliance there is on social protection and whether this is a flaw rather than a benefit in public policy. Thanks.
Mm-hmm.
Yeah, this is a question for both of you, and maybe I can also add. I mean, as Marcos says, I mean, social protection is getting a lot of budget share, and also as Professor Shell said. So are we compromising the long-term growth? Is because mostly social protection focus on, saving, avoiding some disasters, short-term disasters and all these things. So we are allocating a lot of budget on current consumption and just compromising the investments on for the futures. Is it that the way? I mean, are we really compromising the future? That's also something that you may reflect your comments on that. Maybe I can start with Mark. Mark.
Yes. Let me start. It's a really interesting question, and Cheryl, thank you for bringing it up. And when I first saw it in the chat, I had an initial response, but now it's more challenging the way you worded it. And this in some ways relates to the point Wayane raised about the enduring effects of COVID-19. So the question about whether it's the benefit or it's a flaw in our system and the amount of budget that's required is a really interesting question. But I want to come to something first, which is not sidestepping the question, but dealing with my first response, looking at it in the chat. And that's this, is that let's make an assumption, whether it's deserved or not, an assumption that social benefit is necessary and it's required and it's it's well distributed, fairly distributed. Now that's a large question, but let's make that, if we make that assumption, then we can ask the effect, come back to Wangane's initial point about the long-term effects of COVID-19. And so we know that one of the effects that COVID-19 has, it has an effect on the economy, right? It has the first most profound effect is on human life and the mortality threat that it introduces. But we also know, and many of us are experiencing more profoundly in Africa and other countries that are economically stressed to begin with, is that it introduces an economic shock that follows and is not easily dissipated. So if we then take that idea and then pair it with the idea that or the assumption that social protection is necessary. Social protection comes from exists because of two things. One is the availability of resources, scarce resources to allocate in that direction, and two is political will that it's the right thing. And both those are challenged under COVID-19. Okay, now that's all assuming that it's the right policy decision, but we do know that there's some portion where it's the right thing to do for a certain segment of the population over some sensible period of time. Your next question, so it speaks to the question about the propagation of shocks, is that the effect of a shock such as a global shock such as COVID-19 has durable, unfortunately durable effects. It's a very persistent shock, which has egregious effects on an economy. Your second question, which is really interesting, is this idea of flaw versus benefit. And one way I think about this is it depends who we're talking about. In the countries where I work, I had a call earlier this morning with FAO, with a colleague of Marco's. We were talking about humanitarian development peace nexus, the HDP nexus, which you're probably all familiar with. But the question is, are we talking about humanitarian crisis or development assistance? And social protection under those two conditions are different. People generally think about social protection as being part of development assistance, but there's immediate response. And many countries move in and out of humanitarian crises and development assistance. And so this is the part where I'm going to say my answer is I don't know. Marco maybe has a better idea because he works in some difficult areas. But what is the role of social protection in areas that are highly fragile? And how is those different where there's greater degrees of stability? South Africa is a really interesting country in my limited experience, now old experience. I've not been there for a while. But South Africa has a great deal of heterogeneity. It depends where you are in South Africa, doesn't it? On how stable it is. In my work in South Sudan, it depends if you're in Yambio near Juba, or if you're in the Upper Nile, or in Jonglei, which are highly conflict-ridden areas. And the same is true of Somalia. I was just looking at some data on Yemen this morning. But even there's a great deal of variation. So we talk about social protection for resilience. I'm thinking for whom, for what purpose, over what duration. So I think, I think I'm saying this is a really, really hard question. When you put it in the humanitarian crisis problem, mixed in with the development assistance challenges, which are big enough on their own, I think we haven't figured it out really yet, how to deploy social protection in a way that is efficient over time, for a population. So I'll stop there because I'm posing questions rather than answering. Maybe Marco can answer them.
Thank you. Marco, sorry.
Well, first, let me start by saying that I apologize, but after I respond to this question, I need to sign off because there is another meeting that is pushing behind. So I apologize for this. I frankly apologize, but when you are not a senior person, a real senior like Mark, you cannot dictate the meetings. And so you receive and you obey. That's what you do. No, just kidding. No, I think the question is super well funded. Is super relevant. Again, there is ample evidence because this debate on whether social protection intervention can create some dependency is well debated in the literature. No? And so there is ample evidence, at least so far in the papers that have been published, that this is not going to happen. Then again, sorry, I'm seeing something in this. So when we talk about social protection, we are talking about a type of intervention that can be impossible to be cancelled. And also, if you're talking about intervention, social protection in humanitarian context, we can't stop this. So maybe the question is more into the development setting. But just bearing in mind that normally, for example, if we're talking about a conditional cash transfer, where the conditionality stands with if you send kids to school. Guys, so we have a short-term and a long-term effort. The long-term effort is that we are investing on those kids. And those kids will be given the chance to study, will be given the chance, and ultimately, we noticed this in a study we did in Lesotho. The short-term effect on resilience could actually even be maybe a small reduction in some sense. Overall, you still gain, but you lose some workforce, no? Because the labor force, no? Because the kid can no longer go and look after the animals, but he needs to go to school. And so in the short term, maybe but in the long term, you're expanding your opportunity and his opportunity or her opportunities, of course. So to me, I understand the point. And let me tell you, Cheryl, this question is very well debated, even in some areas in Italy, because many people that are receiving, the minimum salary, then they tend to create this dependence. So they live with that minimum salary. But maybe we need to look at the technology, so of the way we're using the technology. No, it's like internet. Internet per se is a fantastic story. But then, of course, if there are pedophilia and whatever else, we need to secure for this. Okay, and so maybe we need to just design the right policy in terms of social protection. Okay, I thank you all, and I apologize. It's the third email that I received in the last 5 minutes. I apologize for this. I really need to sign off. Thank you for this great opportunity. It's exciting.
Thank you so much, Marco.
No, thanks to you. Thanks to you.
Thank
good to
you
see you
so much.
all around.
Thank you, Marco, and thank you for coming. And we have actually 2 more questions, but maybe Mark will help us on those questions.
Me with all the questions, I think, now, Marco.
I think let me give the floor for students, then they can present the questions. Hussein, are you around? You can present your question. Hussein? If not, I can read it from the chat box here. Yeah. I think Hussein wants to know, I want to know the extent at which migration of people has been displayed in the, I think this is for macro, I think so. This is a resilience capacity index, especially in the conflict affecting countries. Dan, thank you, Dr. Marco. I think this is for Marco.
Yeah. Marcos,
please go ahead, Mark.
I'd like to address this question, not with reference to RCI, but in reference to when we collect data and the limitations of our data collection and what we need to do. And this is for students to think about, because it's what we need in the future. And I'll tell, it's 11:21, so I can't tell a long story, except that I can make a quick reference to a survey that was conducted by a colleague at a well-known organization that I will not name, and it was a household survey. And the household survey, when he started listing the questions, this is a highly reputable organization. I said, how long does this household survey last? He said, an hour and a half. I said, I think that counts as a shock to the household. When you walk into the household and give them an hour and a half survey. And, one of the problems we have when we think about migration is that our data is so temporally sparse. We collect data once a year, maybe twice a year, and the frequency of the data collection is not at all sensitive to things like migration patterns. We take seasonality into account, but in many countries, the migration patterns introduce a lot of volatility into the landscape of populations and their requirements. And so, one area of really important work is coming up with light touch data collection, where we can do higher frequency data collection and collect data once a month, once a week. I'm working on something where we're able to do once a month, but I want once a week data collection and really understand the volatility of what's going on. In many of our household surveys, we ask people, what did you, in the last month, tell me about your diet? I mean, who remembers what they ate yesterday? Never mind last month, how many times we were without a meal. So it's highly problematic. And this speaks to the migration question. Migration makes a country volatile, and we're not sensitive to that volatility. IMO is international, some UN offices are, but in our data, we're not. So really important point in being sensitive to that. Look what's going on in the Ukraine and the pressures that's exerting. The migration flows in some countries I work in sub-Saharan Africa is quite important. And I would say we're not sensitive to it, and Marco's not here, so I'll speak for him. I would say he has done work in this, but I think it's the data, the RCI does not reflect that sensitivity. I'll check with him on that.
Okay, good, thank you. Yeah, I think that's fair enough because of the data issues. We need some high frequency data and all those things to capture not only migration, but also other issues that has to be included in the index. And also we have another question from Pamela. Pamela, can you ask a question, or Pamela?
Is this Millie's question about preparedness? Was it that question, or?
I think Pamela's question was answered. I think there's a question from Dani and one from Millie, yes.
Yeah. Mm-hmm.
No. Now, in the Q&A questions, we have two questions. One is by Pamela, which is about actually the upscaling of development and move people from poverty. And let me read. Social protection has a very huge role to play in reducing the impacts of various shocks and poverty. How then can the social protection programs be crafted to ensure that they can only target vulnerable groups, and how can social protection be used to upscale development and move people from poverty, maybe through capacity building, so that year upon year? I think the question is two things. One, on the targeting, the social protection targeting issue, how to address most vulnerable groups, and the other one is how to make it more productive. And probably let me start my answering by this one, because I'm from Ethiopia, and Ethiopia has this very big social protection. I was trying to review those social protection programs in Ethiopia, the PSNEP, the Productive Safety Net programs. And there are a lot of studies that have been conducted by the Michigan State Universities and also by the different actors about targeting efficiencies. I think in many cases, in many of the social protection programs in Africa, we have a problem of those targeting issues. And because of so many political and data problems and all those things. So I think those are some of the biggest gaps where we have to find it. And because the one we talked about, the dependency syndrome, the dependency issues, all those comes because of inefficiencies in targeting and all those things. So I think this is very critical, but I think we should work hard on that. Rather, in terms of making it more productive, again, I think we have to look at the different instruments for social protection. For example, the one with conditional and unconditional social protection. For Africa, it's not as such very significant whether we make it conditional or unconditional, unlike the Asian case. And probably one way is, for example, in Ethiopia, I see that they have this food forward, or just like a conditional support based on the labor contribution for public workers. And those things might be translated short-term benefits to long-term benefit and to sustainability. So this type of social protection arrangements can be done everywhere, depending on the situations and depending on the problems. So those are just my small reflection. Maybe Mark can give us more insight if you have all those things. Mark.
No, I don't. I completely defer to you in your work in PSNP, or my colleague John Hodden.
But maybe Mark could answer the question Dani Jordan asks about, should we focus on determining resilience or the fragility of systems?
Yeah, so that's a really interesting question, because I think, and we've had, with some colleagues here at Cornell, we've had ongoing discussions about the relationship between fragility and resilience. And one question I've had is, can a household, community, or a larger aggregate, such as a community or region or a country, can a country be both fragile and resilient at the same time? Right. And I think we have to come up with a way to answer that question with yes. And the reason is that fragility has to do with a set of structural conditions that are it will take a long term to correct. And if we say that you're fragile, therefore you can't be resilient, and I don't know that the question wasn't necessarily suggesting that, but I think it's really most important to think about the countries that are fragile, that are most susceptible because of structural conditions and environmental conditions such as agroecological degradation and climate change, things that are in some ways completely out of their control, that are making them structurally fragile. How can those countries develop some level of resilience, be able to, as a cliche definition goes, how can they bounce back when hit with shocks? There are people who transformative capacity sounds nice, but not everyone's able to transform. Not every community can transform. They don't have the capacity, they don't have the resources to do so. There are communities who live in a flood-prone area who will continue to live in a flood-prone area and be hit year in, year out. And the question is, what can we do with those communities to help them bounce back after being hit with the shock? So to me, that's one of there's so many questions here that have been raised that are kind of the big challenges. One of the big challenges going forward is to think about, what about the most fragile countries? What, what about the Yemens, the Somalias, the South Sudan and Bangladesh, and what about those countries? And we can't write them off and say they're fragile and they can't be resilient. Again, I'm playing with the question here to my advantage. And I think, I think that this is going to be really important. It's actually linked in with another question, Cheryl, that I think Millie asked, is a question about preparedness. And this becomes key. And here I start to twitch and flinch when we talk about preparedness, because preparedness is the answer. And the reason I twitch a bit is that we're now in the land of political economy, is that whenever there is a humanitarian disaster, donor organizations will let down massive amounts of money, because they should, but they also should let down massive amounts of money for preparedness. But preparedness doesn't get the same kind of attention, the need to prepare, as a disaster does. And this makes me sad. The political will for preparedness just is not the same. The global attention to say, let's prepare a community. And even if you didn't care about the community, which we do, is the cost effectiveness of preparedness as opposed to responding to a disaster is much, much better. So when we think about the fragility part, we need to think about how can we prepare them so the amount of damage experienced is least in a mitigation sense. So, yeah, but I think I've tried to do two things at once. Come back to the fragility question again. I kind of ran over that one. Could you say it again, Shirley? Because I think I missed part of it.
So he asked, should we focus on determining resilience or the fragility of systems?
Yeah, I'm both. I'm saying both. I think we need to think about the resilience of fragile systems. There's a paper I'm working on right now with colleagues at FAO on thinking about how do we think about food systems in fragile contexts. And the whole idea of a food system makes certain assumptions that they're modular units, that there are connections, and the question about what does a food system look like in a fragile context, it needs to be reconceptualized, and thinking about what it means to make a food system resilient in South Sudan versus South Africa, for example, or Malawi versus Nigeria is a very different proposition. Though of course there's a lot of spatial heterogeneity within countries. It depends where you are. As some of your students will say, I think it's Balayat who I think knows about Nigeria. A lot of spatial variation there. So my answer is yes. We need to pay attention to both of those. Think about how do we manage resilience in fragile contexts while trying to correct the structural conditions that bring about fragility. So.
Thank you, Mark. I think this is very unfortunately we're running out of time, and then we have. Yeah, but it's a really a nice topic to discuss about fragility and resilience. I think you might have seen some of the works from John Olumingu. He was thinking about how to measure resilience in a very fragile environment like South Sudan, as you said. So I think in those contexts, it might be a little bit different from the usual resilience measurement. I think with this remark, I think we have to end up here, and thank you for coming and presenting and sharing your experience and your expertise. Thank you, Mark, and thank you, Marco, even if he's not around. And thank you for the discussants and for reading the chapters and also providing very insightful comments and questions. And with this, I invite Professor Sher to give us some closing remark, and then that will be the end of the session. Yeah.
Just a very big thank you. I'd like to acknowledge the ED of Academia 2063, Dr. Usman Badian, who is online. Thank you, Usman. Thank you to the team. Thank you, Gitao, for your facilitation Thank you, Mark, for your fantastic presentation and thoughts and willingness to think on your feet, to demonstrate to our students what that task takes and that you have to think nimbly and quickly on many emerging topics that are surfacing in this very volatile situation in which we live. So thank you to our discussants. You did a fantastic job. Thank you to the participants for being here and for your questions. I see you getting bolder with asking them. That's fantastic. Thank you, everyone. And thank you to the team behind all of this. Have a great weekend. Thank you.
Thank you, Cheryl.
Thank you,
Professor Mark, and everybody. Great
Thank
stuff.
you, Mark.
Ciao, ciao.
Thank you, Vital.
All right.
Thank you, Julie. Thank you, Cheryl. Thank you, everyone. Bye-bye.